The CBID team began after the COVID pandemic, and the public health of Hennepin County realized this was really hard on our staff. It was very difficult. We went through many, many months of high stress work, and if there's an opportunity to create a team that's able to do this work and be ready to do this work, that's an innovation that we need to embrace and to ensure that not only are our staff doing what needs to get done, but they have a good mental capacity to be ready to come to the work. The first outbreak that we had to respond to was the Mpox outbreak last summer and fall. Our team was essentially rerouted in a single day to work within the public health clinic in downtown Minneapolis. They had gone from about 75 appointments a day to over 200 appointments a day.
We have extensive background in public health, so I think we did well with adjusting our schedules, knowing where the need was.
We really did learn from COVID-19 that staff burnout is huge when you have to be completely changed overnight. And if there is the opportunity for people to be that can go between, that can move around where they're needed and are ready for that, I think that's a great opportunity for other sites.
The biggest thing we bring to the table is we're enhancers of every single team that is already made. We're making more resources available to systems that are already in place.
The rapid response is the biggest, or one of the largest benefits of our team. It also assists the community-based aspect is a huge benefit because we can work with people who don't want to come into clinic or who have trauma around clinic.
We are focusing on bringing healthcare to the communities that are underserved. We know that, any sort of crisis hits BIPOC populations the hardest. People who are experiencing homelessness, people who are experiencing a lot of barriers to care, they get hit the hardest. So we're bringing the healthcare to them, making it as easy and accessible as possible.
We were able to start doing events out in the community, and we recognized that after the fact, okay, how can we make this more accessible to people who have those barriers, who might not be able to come to a clinic that's only open 8 to 4. So that's one reason that we're also working on improving our workflows to ensure that's available.
Knowing that we are bringing the healthcare that people deserve to them. It's not in volumes, it's not in high volumes, but it is truly people who won't get the care that they deserve in any other way. Just knowing that we are serving the most vulnerable populations, I think that just knowing that to me is good. It gives me a sense of pride.